Hello everyone. Today I'm going to discuss about the lung sounds and heart sounds in the diagnostic clinical examination. So first coming to the pulmonary auscultation, also called as we are going to check for the lung sounds. So before going to the checking the lung sounds, we have to know what are the important points and also what is the do's and don'ts. So we have to know about the auscultation of the lung. So this auscultation is perhaps the most important and also effective clinical techniques you will ever learn, and also for evaluating the patient respiratory function. So maybe this one is with this device, we are going to assess and also we are going to evaluate the patient respiratory system. And also before begin, so there are certain things you will keep in mind. So before starting the lung sound assessment and also pulmonary auscultations, so you have to keep in mind some important points. So for this checking the lung sounds, so the room should be quiet environment. So it should not be in the noisy, and also if it is any visitor room, and also if anything noise is there, so we have to try to close the room, and also we have to hear the lung sounds, normal lung sounds and abnormal lung sounds while auscultating. So room should be a very and also calm and also quiet. And also if any any noise because of the any like a TV or radio or any sound system, so we have to avoid, and also it should be is a calm. So that is the main area for the checking for the auscultations. And another important thing is the position, also very important. So the position should be for the auscultation sitting up in the bed or on the cot, and also ensuring ESR's chest not leaning into against to the anything. So it should be like a comfortable position. Patient should be comfortable, and also sitting up in the bed or cot. So is going to be high sitting positions. And if it's not possible to lean to, for example, it should not be lean against to the any chair and to the bed. But in those conditions, so ask them to do in the comfortable positions, but we can take only partial assessment. So if they lean to anything to against to anything, so sometimes we cannot hear the clear sound, so may it interfere the sounds. So, and also while placing the stethoscope should be touching the patient bare skin. So if it plays the bare skin, so whenever possible, you may hear the rubbing of the patient's clothes against the stethoscope and misinterpret them as a normal sounds. So it may give the abnormal sounds. So if it's possible, the patient should be in the bare skin. So then only we are going to hear the exact sound. But if sometimes if the dress may interfere or maybe misinterpret the abnormal sounds. So, and also you may wish to wet the patient's chest and also hair with a little warm water, and also to decrease the sounds caused by the friction of the hair against the stethoscope. So sometimes while checking the lung sounds, because of the who are having the chest hair, so may interfere the sounds. So it may use the friction also. So if you want to prevent these frictions, so slightly we have to wet the patient chest, the hair area. So we are going to prevent any abnormal sounds, and also friction we are going to avoid. So these are the precautionary measures while assessing the lung sounds. And also always ensure the patient should be comfortable, and also be considerate, and also warm the diaphragm of your stethoscope with your hands before auscultation. So if sometimes if it is any if it's not clear, so sometimes it may interfere the sound. So that's why before giving that we have to rub the diaphragm area and also stethoscope. So we are going to give make them into clear to hear the clear sound. So as you are auscultating your patient, please keep in mind the two things we have to keep in the mind. So these are is it the normal sound or abnormal sound, or is there any the sounds are decreased? And also one more second one is are there any abnormal or adventitious sound breath sounds? First one is we have to check is it the normal sound, or is it increased or decreased, or another one is the abnormal sounds. So these things we have to think before checking the lung sounds. So while checking the breath sounds, so we have to check the proper in the sitting positions. So if the sitting in the posterior check or in the posterior chest wall, if you are checking, so ask the patient to cross the arms in the front. So if it's possible, so then only we are going to hear the sounds in the backside the clear manner. And also auscultate using the diaphragm of your stethoscope. So we have to use the diaphragm for the auscultations, and ask the patient to not speak and also breathe deeply through the mouth. So if they take any deep like inspiration through the mouth, so it's going to be hyperventilated. So may chance to get the normal, like we cannot hear the normal sounds. It may give the abnormal sounds. So be careful while giving the assessing the patients. The patient should not take the more ventilation and deep breathe, long deep breathe. It may hyperventilate. And also you should listen at least one full breath in the each locations. So we have more than 12 to 14 locations are there to hear the breath sounds. So at least the one breath we have to heard in the different locations. Then only we are going to identify the where is the normal lung sounds and where having the abnormal lung sounds. And also it is important that you always compare what you hear with the opposite side. So if you compare to the right side, if you heard the sound to the right side, then compare to the left side. So then only we can understand where they're having the abnormal sound. Is it the like a right lung affected? Or maybe is the upper lobe or middle lobe or lower lobe. So then we can compare with the same with the right lung. So then only we can understand where they're having the secretions, where they're having the obstruction. So where they're having obstruction due to fluid or air or mucus. So where we can clearly understand, it depends upon the involvement of the segment. So if you divide into the lung and also the different lobes are there, and also in the lobes again is going to divide into the segments are there. So we have to like auscultate each part of the lung. So then only we can understand and also we can differentiate the what is the causative factor for the abnormal breath sounds. And as examples, if you are listening to the apex, left apex, and also you should follow the through by the comparing the what you heard with the about the right apex. If you check the right apex here, then we have to check for the left apex also, or in the upper lobe, or also we have to compare the upper lobe of the like a right lung and also left lung. So about the auscultation locations, so these locations are going to be 12 to 14 locations we can see in the in the anterior and also posterior chest wall. So at least from the 12 to 14 areas, at least 6 locations we have to assess. Then only we are going to find the abnormal and also normal heart sounds. So begin by auscultating the apeces of the lungs. So it's going to be moving from side to side and comprising as you approach the bases. So that means we have to check at least minimum the 6 areas. In the 6 areas, if you see here in the anterior chest wall and also posterior chest wall, so at least we have to any 6 points, 6 areas we have to and also auscultate at least in the one area, and also is at least in the one breath we have to check. So how is the breath sound? Is a normal or abnormal sound? So if you see in the anterior, so we can found in the at least the 5 to 6 areas. So here we are going to found in the second intercostal space and also fifth intercostal space and also seventh. So here is the place of locations are there according to the surface anatomy. If you have an idea of the surface anatomy, we have to place it, the places, so we can hear the normal and abnormal sounds. So these are the points to assess and to locate the the breath sounds. So different types of the breath sounds are there. We are going to discuss all the breath sounds, normal breath sounds as well as the abnormal breath sounds.